quite simply, small fiber neuropathy is a peripheral nerve disorder, peripheral nerve condition, a type of peripheral neuropathy that affects just the smallest nerve fibers. So our nerves are like cables. If you think of a cable with different size wires, there can be big fat ones or medium ones and very small ones. And our nerves will have fibers that are very small and medium and larger ones. And each of those fibers serve different functions. And the small fibers are the most primitive, and they're involved with detecting pain, detecting temperature changes. And most of the time, if somebody gets a peripheral neuropathy, like somebody has diabetes or they have chemotherapy that injures their nerve, most of the time it affects all the nerve fibers, and we call it a mixed fiber neuropathy. But for some reason, some conditions can exclusively affect certain fiber types. So in small fiber neuropathies, just the smallest fibers get affected. Most of the time, that doesn't change the way the neuropathy shows up or looks. So a physician or other neurologist is able to clue in that it's a neuropathy because people have numbness, and it'll typically affect the longest nerves first, so it starts in the feet, or maybe in the feet and the hands. Where it gets interesting is that some people with small fiber neuropathy, and we're not certain why, some people, the appearance of neuropathy is very different, and it's not like a typical neuropathy. So their numbness or their sensory symptoms can show up in what we call a multifocal pattern. So it can be different parts of the body. It can be intermittent. So most neuropathies, once they develop, the sensory symptoms come on and they stay there. So your feet are always numb. The degree to which you notice it may vary or fluctuate, but it doesn't be numb some days and be normal other days. But small fiber neuropathy can do that. And it took us a few years to sort of catch on, so we didn't really realize we'd be seeing these patients, and frankly, some of them we would think were, psychogenic or crazy in some way, or testing became available for small fiber neuropathy by doing just a punch biopsy on the skin, taking off a little circle, a little disc of skin from certain areas, sending it to a lab that could process it in a very specialized way so that the small nerve fibers could be visualized. They could be quantified, count them, see if the amount of nerve fibers was abnormally decreased for that area, or if the appearance of the nerve fibers was abnormal. That technique gives us a very useful tool to identify and diagnose small fiber neuropathy. So initially that testing was available just in a research setting, and then 15-ish years or so that became available on a clinical basis, and is much more so available now. And as clinicians started doing that testing more, we realized, wow, there's a whole other spectrum to how small fiber neuropathy can appear. The treatment for small fiber neuropathy is very much going to depend on what's causing the neuropathy. So like other neuropathies of any kind, mixed fibers, small fibers, the key is figuring out what's causing that. And so some common causes are going to be conditions like diabetes, they're going to be side effects from medications or toxins, and then some of them are going to be autoimmune disorders. Autoimmune disorders are always sort of the holy grail in neuropathy because those are the most treatable. So unfortunately, a lot of times once somebody develops a neuropathy, all we can do is treat the symptoms. But if there is inflammation or an autoimmune attack on the nerves, then we've got therapies that can not only stop the progression, but sometimes heal and reverse it. And so once somebody's diagnosed a small fiber neuropathy, then the next step could be getting certain blood tests, the laboratory tests, looking at the patterns, and then trying to figure out, is this something that I can treat this way or that way.